Have you ever wondered what one of the biggest fears is for people living with lung conditions in the UK? Well, let me tell you. For people like me who suffer from asthma, our fear is simple. It's this right here, moving. To try and help solve this, Asthma Lung UK worked with service design experts at Humanly, as well as with people like me who suffer from lung conditions, to try and find an innovation that would help people like me do one thing: move more.
I'm Jenny. I work for Humanly. We are a human-centred design team, and we've been involved in this amazing project over the past year, working with Asthma Lung UK and a whole team of co-designers to try to identify and support the best respiratory innovations in the UK right now.
My name's Erica Kennington. I'm Head of Research and Innovation at Asthma Lung UK. Historically, we've always tried to involve people with lived experience, people with experience of lung conditions in the research and innovation projects that we've done, but we really wanted it to be central to this project. So our working group, our design team, to design the whole project, we made sure was 50-50 people working both humanly and Asthma Lung UK, but then 50% people with lived experience of lung conditions.
Over the course of 1 year of Zoom calls, meetings, collaboration, and analytical work, we found two app solutions: Breathment and healthtech.
So at Breathment, we are revolutionizing respiratory care with our AI-powered digital health platform. The AI trainer that we integrated to our mobile app enables the patients to perform their self-rehabilitation exercises from anywhere using only their mobile phones. So it instructs the patients on how they should perform the exercise in an audio or visual way, and it monitors the patients only through the front camera of their phones. So this enables our solution to provide a 24/7 accessible, personal physiotherapist for the patients.
We know that Asthma Lung UK want to get the best for patients, and that's exactly what we want to do for healthtech and help more people learn how to manage the breathlessness, be more active and address their mental health as well.
So we found two solutions. Now what? To take things further, we had people living with lung conditions from all over the UK, from many different backgrounds, test these apps over the course of 8 weeks.
As well as our co-design team, we had an amazing cohort of testers who actually used these products over 8 weeks as part of their day-to-day lives and reported back to us on their experiences, their feedback, their challenges, and we got a real deep insight into what it was like for them to use these products over time and in their real lives.
So the reason we decided to use mobile ethnography for this particular project is because it gives a really rich insight into what it is that, what works and what doesn't when you're thinking about the kind of products that we were looking at. It's much richer than just talking to people afterwards because they've often forgotten. So it allows us to see in real time what they're experiencing, what is working and what isn't working.
You know, it's all very well if some technical expert looks at this and says, "Oh, technically that's a good app," and I think, yeah, thank you very much. That's a nice bit of feedback. But if somebody with a lung condition comes back and says, "Wow, that really changed things," that's what, you know, that's the bottom line. That's what really matters. That's what we're after. The actual assessment progress was incredibly good. It was incredibly rigorous and obviously done by people who know what they're talking about and heavily, most importantly, involved patients with lung conditions.
So the impact of co-design on this project has been massive. It's been so important to get the co-designer's voice and opinions across the entire project. So from designing the research, designing the evaluation criteria for the products, helping to shortlist which products we even wanted to interview, and even planning how we made the application forms for the products. The co-designers have fed in at every step of the way and have been absolutely integral.
Hello, my name's Fiona and I have COPD, which is a recognised lung condition. So for me, the whole process, the whole 10 months that we've spent, to me has been one of the biggest educations that I've had, because it was about one thing, but there was so much involved in it that I learnt so much. So it was just an incredible education for me.
This year has been so jam-packed. Not only did we have the chance to come up with some awesome solutions for those people living with lung conditions, but we also had the chance to showcase our work at the Service Design in Government event in Edinburgh, and rounded things off with a wonderful celebration in Asthma Lung UK's head office in London. Oh yeah, and before you go, if there's one thing I can take away from this entire project that I've been working on in the last year, it's that I no longer have the irrational fear of moving more than I used to a year ago.